welcome to our second video in our series on your lymphatic system and lymphedema for Lymphedema Awareness Month. My name is Angela Wicker Ramos, and I'm a certified lymphedema therapist and oncology rehab therapist here at Cancer Rehab Austin. So last video we talked about what your lymphatic system is and what it does, and how it's impacted by cancer treatment. So today we're specifically going to talk about what happens when your lymphatic system is not working and what are the treatment options out there for lymphedema. So edema, what that means is swelling. So it's just a medical word that means swelling. It is a symptom or a side effect. However, lymphedema, what that means is it's a specific swelling because your lymphatic system isn't working properly. So lymphedema happens when your lymphatic system has been injured, or when it has fatigued over time. Sometimes lymphedema can occur because people are born with an issue in the development of their lymphatic system, or sometimes it occurs secondary, meaning it occurs because something external has happened, such as cancer treatment, such as an injury, surgeries, diseases such as cardiopulmonary issues, things like that. So what is lymphedema? So signs of lymphedema are swelling. However, sometimes the first symptom can be a heaviness or an achiness in the area where your lymphatics have been damaged. So sometimes you can feel that heaviness and that achiness before you can actually see swelling. So if you know you're at risk for lymphedema and you start feeling achiness or heaviness, definitely go to one of your medical doctors on your team and just let them know, okay? Because the earlier that you are diagnosed with lymphedema, the easier it is to be treated. Okay, but remember, swelling is definitely a sign of lymphedema. Also, a feeling of tightness in an area. A feeling of tightness is usually associated with the swelling. So if, let's say you're at risk for lymphedema in the arm or the hand because of breast cancer treatment, then if you start feeling tightness in your grip, that might mean there's some swelling in the hand, okay? Or if you start feeling some tightness in the elbow, that might mean there's some swelling in the elbow. Also, you want to start noticing how things fit you in general. So if you have a shirt sleeve that normally isn't tight at all and it's starting to feel tight, or if you're wearing a bra, you take off that bra and you see indentions in the breast area, the chest area, or the rib cage that are more on the side of your treatment than on the opposite side, that might be signs of lymphedema. So you definitely should go follow up with your medical team, let them know because you might need treatment. Now, lymphedema is a chronic issue. It is a progressive issue, meaning if it's not treated, it can worsen. And right now, there's no cure for it, meaning we can't eliminate it entirely. However, there's some really effective treatments out there that help reduce the swelling, help reduce the discomfort, and help manage it long term. And these treatments, the gold standard treatment, or the one that has been around the longest and has the most research behind it, is called complete decongestive therapy. Complete decongestive therapy is a group of modalities, and the group consists of patient education to ensure that you can manage your lymphedema, you can help reduce that swelling yourself and help make sure it doesn't worsen yourself, so being independent with your home management. Also, manual lymphatic drainage, which we'll talk about further in another video, but manual lymphatic drainage is a manual technique that helps reroute fluid away from the area of swelling. Decongestive exercise, again, we're going to get into that further in another video, but exercise is very important in moving lymphatic fluid through your body. The main way that your lymphatic system moves fluid is by your muscles contracting and relaxing. So exercise is very effective, but exercise needs to be done in a slow, progressive way under the care of your medical team and your lymphedema therapist. Also, compression. Two forms of compression. We'll talk about it further in another video as well. However, just a general summary, there's compression bandaging, which is a multi-layered bandaging technique that your lymphedema therapist would do to help significantly reduce that swelling, help get rid of that swelling as much as possible. And then compression garments or sleeves help maintain the gains you made with the bandaging or help ensure that that swelling doesn't get worse. And then the last thing when it comes to lymphedema treatment, there are some other techniques that aren't under complete decongestive therapy, but they may help as well, and in conjunction with complete decongestive therapy. Some of those things may be kinesiotaping or elastic taping, PhysioTouch, which is a negative pressure machine that helps suction the tissues gently upwards to help move lymphatic fluid. It also helps soften the area, decrease some scar tissue or hardening or fibrosis that may occur. And then there's compression pumps as well. Compression pumps can be helpful along with complete decongestive therapy in some people. But again, those are alternative treatments that your lymphedema therapist will decide whether are appropriate for you in conjunction with your complete decongestive therapy. So that, in a nutshell, is lymphedema. If we're going to take anything from this video, it's if you start experiencing signs of lymphedema, heaviness, achiness, swelling, discomfort, definitely follow up with the medical team and know that there are treatments out there. They can be and should be individualized towards you to help you decrease the issues with this disease, to decrease the swelling and ensure that it doesn't progress. All right, thanks for taking the time today and to listen to this, and I am definitely going to do some more videos with greater detail about every single one of those treatments. We're also going to do some videos discussing preventative practices or ways to decrease your risk for infection or increase swelling, and then what we know in research when it comes to things that increase your risk for lymphedema and things that may potentially decrease your risk. So thanks for taking the time, and I look forward to you joining me for our next video. All right, take care, you guys.